Good afternoon and welcome to our DSPD Provider Quarterly Meeting. I'm so grateful to have you all here. It really is important to us to have a forum to share information with you, as well as have a way of hearing from you, kind of what your questions are, what your needs are. So I'm really grateful to have this time for us to all come together. We start with presenting some announcements or information, and then we move to having the Q&A at the end of this session. If you have questions throughout the meeting, please place them in the chat. That gives us a chance to get through everything that's on the agenda, as well as make sure that we're answering your questions and following up there. I'll go ahead and start with some information. We've received a request from a couple of providers about what our priorities are for our provider system over this next year, as they're preparing for leadership retreats or staff trainings. I want to start out just by saying thank you so much for reaching out. I really appreciate it. I appreciate the prompt to have us put something together so that you have that, and that everyone receives the same information, as well as just the partnership and the collaboration. So thank you. We worked with the Office of Services Review and have 4 primary areas. So the areas that we have are quality supports and services, focusing on those quality services. Another is mitigating abuse, neglect, and exploitation. A third is employment and integration. And then a fourth is preparing for changes and navigating the access rule. Those are in no specific order. And while they're not the sum of the work that we're doing and that we're focusing on, it is a really good place for us to all be focusing collaboratively. We'll be sending out an email that has these listed, as well as things that both the Office of Services Review, DSPD, and our department are doing to focus on these areas, to support our system, to look for training. So thank you for the question again, and we look forward to continuing to work together. I'm going to turn some time over to Becky Dalby so she can give us some contract information, and then following Becky, Camille is going to be giving us some housing information.
Thanks, Angie. I just wanted to make sure everybody was aware that a request for information was posted for getting feedback on our support coordinator contract. Our support coordinator contract does expire at the end of June, so we're starting to gather feedback now. So if any of you guys have feedback and you want to respond to that RFI, please do. If you did not get notification of the RFI, please email at dspdcontracts@utah.gov and we can get you that information. That's the update I have, Angie. Thank you.
Thanks, Becky. I think we have Camille on here.
Hi, I'm here. Sorry. I'm at E72 right now, so I can't show my camera, but yes, I just wanted to remind everyone that we are replacing our housing quarterly meeting with our one-on-one training that we are offering to all providers. We've had a great response so far, and we just want to continue to make sure that we continue to have that great response. So please contact us at cbowen@utah.gov if you'd like to schedule one of those one-on-one trainings with your staff. As providers, we'd like to review resources and just discuss the silos and barriers that you guys are experiencing in the community as well. So just wanted to give that nice reminder to our lovely providers, and we appreciate all that you do. I've had great meetings with the ones that I have met with, and they have been very informational, very descriptive, and we're able to help with a lot of resources. So just want to continue having that great training with the providers. We've had a lot of new providers, and it's been great. So please request a training at cbowen@utah.gov, and we'll be happy to schedule more one-on-one trainings with your staff. Thanks, everyone.
Thanks, Camille. We also have, I think it's Sashka is here today. I'm trying to look quickly across, either Sashka or Jasmine.
It's Jasmine.
Oh, it looks like Jasmine is here. with HSRI, that's the Human Services Research Institute, who is doing our long-term services and support study for aging and disability services. So I'll turn the time over to Jasmine to give us an update.
Thank you, Angie. All right. Okay, is everybody able to see a PowerPoint on the screen? Okay, wonderful. So hi, everybody. My name is Jasmine Hepburn, and I work for the Human Services Research Institute. And I'm here today to give an update on the Utah Long-Term Services and Supports Research Study. So this is just a kind of a grounding in case you are not familiar with the Utah LTSS research study, LTSS being long-term services and supports. So the purpose of the study is to learn from people in services and people waiting for services, family members, providers, support coordinators, advocacy organizations, and other community members about what's currently going well and not going well in the service system. So we will be making recommendations to Utah's Department of Health and Human Services on how to meet people's wants and needs in a person-centered way, how to structure services, create greater capacity to serve more people, and how to expand individual choice. So that's the purpose of our study. It's a cross-population study, which means that we are speaking to people with intellectual and developmental disabilities, people who are aging, have physical disabilities, and who are medically complex and/or fragile. This is a roughly 2-year project. We are finishing our first year, which is focused on engagement and research. And we're going to be entering our second year, which is focused on the projection of needs analysis and a final recommendations report. Our final recommendations report is really taking all of the engagement and research that we did so far and turning it into actual recommendations instead of opportunities, which is what we've been working on so far and hearing back from people about. So since we last spoke in June, this is some of our updates. So in August, we completed 2 community listening sessions, and they were attended by 92 people. We spoke with people with disabilities and their loved ones, older adults and their loved ones, professionals supporting people with disabilities, and professionals supporting older adults. That was a wonderful time, and thank you to anybody who might have attended those listening sessions. We are also finalizing 4 research briefs on what we're calling our second set of research topics. The briefs will be uploaded to the project website, which we can pop into the chat, which lives on the DSPD website. These briefs are about home and community-based services payment models, a Medicaid training and technical assistance center, the possibility of a Medicaid training and technical assistance center, trends for people with complex behavioral and medical needs, and supports for people with developmental disabilities and mental health needs. We are also continuing to meet with various organizations and groups in the Aging and Disability Network. And just this past week, we presented opportunities to our steering committee on our final set of research topics. And those topics are institutional versus home and community-based service settings, quality of care in long-term services and supports, long-term services and supports array, meaning the services that are offered, and Medicaid structure and funding options. All right, so we're going to dig a little bit deeper into our current research topics, which you have just seen. These are the ones that we presented to our steering committee, but we wanted to give you all a bit of a better understanding of what these topics are. So our first is institutional versus home and community-based service settings. So institutions are places where many people with disabilities or older adults live together. People receiving institutional services can receive services 24 hours a day. And DHHS wants to understand what the difference is between getting services in an institution or getting services in home and community-based settings. That is our first research topic. The second is quality of care. So DHHS has to make sure that the services it pays for are good. DHHS has to tell the federal government how well they serve people with disabilities and older adults. DHHS wants to make sure that it measures what is important to people. That's our second current research topic. We also are researching long-term services and supports array. So people with disabilities and older adults have lots of options for long-term services and supports. People might not want all of the services. People might want different services. DHHS wants to figure out what services people need and want. They also want to know which services people do not need or want. Finally, we have the structure and funding options for Medicaid long-term services and supports programs. So services are paid for by Medicaid. People who are eligible for services get on a waiver. Waivers serve people who have different disabilities and older adults. There are 9 different waivers in Utah. DHHS wants to know if they should keep these 9 waivers or if they should change them. DHHS wants to make it as easy as possible for people to get what they need. And please feel free, if you have any questions, we'll be sharing our contact information. I realize this is a lot of information. So if you have any questions, you're very welcome to reach out to us. Speaking of, these are our upcoming opportunities for engagement. So we have research interviews or focus groups. We would like to connect with you if you have suggestions or experiences that you would like to share regarding our current set of research topics. You are welcome to reach out to me directly, and I will share my email in the chat to express your interest. We also have a feedback and participation form where you can give feedback through the form, as well as indicate if you are interested in different types of participation. So if you don't really have quite enough time to maybe do an interview or participate in a focus group, that is one way that you can participate and we can hear from you. Oh, there we go. I'm sorry. Here to the right, we also have the feedback and participation form. So again, you can provide feedback directly through the form, or you can share your contact information if you would like to participate in engagement. We have a QR code at the bottom right of the corner. So if you want to complete the form, you can pull out your phone and open your camera, point it at the screen, the QR code, and you should be able to go straight to the form. And we can also pop that into the chat. And again, here is my name is Jasmine. This is my email. You're welcome to reach out directly if you have questions or comments about the study. And we thank you very much for your time.
Thank you so much, Jasmine. We really value the work that Jasmine and her team are doing. We look forward to the information, and thanks to everyone who's either on the steering committee or who has been participating in their focus groups and listening sessions. If you're not familiar with HSRI, the Human Services Research Institute, you could probably do a quick online search. They have a long history and experience in research and engagement in services for people with disabilities over time, and have a lot of credibility. And we're really grateful to have them working in our state with us. So thank you so much for the work you're doing. Gonna go ahead and give some time to Matt Lund. He's with our Medicaid team, the Division of Integrated Healthcare. He's gonna go over some electronic visit verification, do a training and overview. This was just based on questions that had come into us, so we want to make sure we're getting information back to you. So Matt.
Right, thanks, Angie. My name is Matt Lund. Like Angie introduced me, I oversee the electronic visit verification team. And my hope here is to kind of reach everybody or each of the providers kind of where they are. So if you've never heard of electronic visit verification, it is a federal mandate to electronically validate that services are being provided when they're not being provided in a facility. So if you're at the member's home, if you're a provider that provides personal care services or home health services, then EVV applies to you. So if it does apply to you and you've never heard of it, I highly suggest going to our website, which I think will be dropped in, or I can drop it in the chat. Nope, there it is. So thanks for dropping it in the chat. So if you haven't heard of EVV, but you do provide personal care or home health services, please go to our website. There's more detailed instructions on what it is, how to what it means for providers, and how to be compliant. If you have an EVV system already and have questions, or are struggling with EVV, please reach out to us. Our email address is dmhf_EVV@utah.gov, and I will drop that in the chat as well. So if you have any questions about EVV, please reach out to us. Our EVV team is quite responsive. They're able to help providers especially once they have an EVV vendor and are set up with EVV. Some of the requirements are when you are making a visit in a home, that you capture that visit with the EVV software. Usually it's a GPS tracker that's an app on your phone. So you'll capture the EVV record, and then you need to submit that record to the state using our EVV portal. And state admin rule requires that you submit those EVV records within 3 months of submitting the claim for payment. So it's an additional submission. Just submitting your claim is different from submitting your EVV record. And those EVV records need to be submitted separately through the EVV portal. And we have an audit team here at the state that is required to perform an audit on all providers that are providing personal care and home health services to help ensure EVV compliance. So if you're a provider, you have an EVV vendor, you're capturing EVV records and you're submitting them, and now you're being audited by the state, the key to a good and successful audit there's 2 keys. One is be sure you're capturing those records and submitting them to the state. And the second is to maintain communication with the audit team. The audit team is here to help providers be compliant. It is not our goal to try to punish or hurt the providers in any way. We're really here to try to help ensure that you're compliant, and we want to help you be compliant with EVV regulations. So hopefully this has been helpful. I think the key messages are, if you think EVV might be applicable to you, please go to our website, medicaid.utah.gov/EVV. And if you have questions about EVV, please reach out to our team, dmhf_EVV@utah.gov. Thanks. Back to you, Angie.
Thanks, Matt. Thanks for making it here. I appreciate it.
Pleasure.
We now have Timara. She's going to go over our person-centered planning training, so we'll give the time to her.
Thank you, Angie. I need to share my screen here. Give me a second. Let's see. Does everybody see my screen?
I can see it.
It says person-centered planning.
Yeah, person-centered planning competencies.
Yes, okay. All right.
Got it.
So So good late morning, everyone. First off, I wanted to introduce you to our new supervisor for our employment plan and inclusion team. So if Shannon, if you're here, introduce yourself.
Hello, my name's Shannon. You guys, a lot of you probably know me. I've been around for a while. I'm now with the employment and inclusion team, so I'm here to support Tamara today. And you can hear from me in the future. And if you have questions about employment first and supporting the vision we're going to have for employment, you can always reach out to me.
Thank you, Shannon. I just wanted to kind of do a quick introduction for her. So, all right, let's get started. So we're happy to be here today to talk about person-centered planning competencies. Providers engage in person-centered planning as part of the support team, but are often tasked with implementing these strategies day to day. So in the time we have today, we're going to introduce you to the next person-centered planning competencies. And so it's been a while since we've talked about these competencies. So let's share some of these resources. So these are the DSPD employment and inclusion value statements. Quality person-centered planning places the person as the expert, focuses on community connection and community access, and prioritizes competitive integrated employment as the first and preferred outcome for all people. Employment is one of the main ways people explore interests and make connections and hold values rolled in the community. So listed here are the 5 competency domains for staff who facilitate person-centered planning, published by the National Center on Advancing Person-Centered Practices, NCAPS for short. And you can download the booklet from the NCAPS website. And there's also a published plain language version, which describes the competency in a way that's more accessible. So we'll add those in the chat. So we are going to focus on the 4th competency today, which is partnership, teamwork, communication, and facilitation. So this competency is about having respect for the preference of the person when talking to them or facilitating meetings with them. When meeting with a person you serve, make sure the person is the focus of the meeting and that everyone in attendance can contribute in a meaningful way. It is about everyone working together for the benefit of the person to help them live their vision of a good life. Communication is a big aspect of this competency. We should communicate in a way that the person prefers and can understand. This may mean using visuals, adjusting the speed of the conversation, or using assistive technology to communicate your message. Be respectful of the person's identity, disability, or otherwise. Make sure that the person gives input when planning activities and meetings. When holding meetings, be respectful of the person. Make sure that they are the focus of the meeting and understand and agree with what is being said or decided. And as paid support staff, you should take the lead in managing any differences and conflicts that arise during the meeting, making sure that the person's voice is the priority. Person-centered planning tools can be helpful in focusing the team on the person's desired outcome. They can also be helpful to resolve conflicts or disagreements. The integrated support star is used to identify the supports a person is already receiving in order to be living an inclusive quality life, along with determining where supports is lacking. This tool is also used to identify partnerships where collaboration may work best in achieving a good life for the individual. There are 5 different sections to the star. So you have personal strengths and assets, which is the teal section at the top. You have relationship, which is the purple section. Eligibility specific, which is the paid supports in green, and community-based supports in blue. And last is the technology in pink. Each section represents a type of support a person may already have in place or those needed for the future. So going back to personal strengths and assets may be the skills, personal abilities, knowledge, or life experience of the person. It can also include things a person is good at or that others like and admire about them. Relationships could include friends, family, neighbors, acquaintances, or church groups. Eligibility specific supports are needs based on services, based on the age, geography, income level, or employment status. It can also include paid support based on disability or diagnosis. Services you must qualify for to access. Community-based supports include places, groups, membership organizations, local services, or public resources everyone uses. And last, technology could include personal technology anyone uses, like an iPad, a cell phone. And it can also include adaptive equipment, assistive technology, and environmental technology, like a smart assistant to control the lighting, or a low-tech item such as a schedule board or a task list. And here's a sample of an integrated support star we created for Alvin Monk. We listed some of the items found on a star on the slide here. This information can help you understand the system and support Alvin might choose based on those that are available to him. And the star reveals things that are important to Alvin, like cheering for the Utes. Connecting to the competencies we presented today, we want to make sure we respected Alvin's preferences, communicated with him in a way that he understands, and that the support team is working together to help Alvin live his best life. So we hope these tools will help you in becoming more person-centered, giving you choice and control to the individuals you serve. And we're here to help, so please reach out to us with any questions to our team email, communityinclusion@utah.gov. Back to you, Angie.
I have one thing to add if I can, real quick. Just in supporting some of what Tamara said as far as person-centered planning tools, there was a training sent out a couple weeks ago called Supporting a Vision for Employment. It is geared towards employment. However, it gives you some really good, significant tools on person-centered planning. It gives you scenarios, how-tos, and tools that you can use to resolve conflict during a plan, or if everybody has different ideas, how to bring them together. It gives you ideas on how to keep the person centered. You also get 4 professional development hours for that training. So it would actually really help with all of the items that Tamara just spoke of too. And it's free right now. DSPD is providing that. Thank you, Angie.
Yeah, thanks, Jamira and Shannon. And thank you so much for the focus you keep there and your availability to support people to be problem solving, like share innovations that you have or have learned. We just really appreciate the work that you guys do. That is the end of the presentation and information we have. So we'll go ahead and open it up to any questions that you may have. We didn't have any sent in ahead of time. And I haven't seen any pop up in the chat yet. So we'll just go ahead and open it for any questions, comments, or feedback you have.
I'll speak up. I think my question is answered. I think I just need to email C. Bowen, but I am new in this role with my organization. And so is that good to sign up for that one-on-one training so that I make sure all the T's are crossed and I's are dotted?
It is a great, Camille had, so just being new, I'll give you a little bit of background on Camille. Camille has worked with the housing authorities for many years before coming to work with DSPD. She has excellent relationships there and really a strong understanding. And she has a huge just passion for assuring people with disabilities have access to housing. So she is a great resource. I definitely recommend signing up to do some one-on-one with her to make sure you guys understand how to apply, how to maintain, how when people get housing vouchers. So yes, thank you for asking, and that is a great place to start.
Okay, so I guess different question then.
Oh,
We are
okay.
a community provider, not necessarily housing.
Yes, I
Is that
understood.
still the
So,
same? Okay.
well, so what can happen, and Camille, please feel free to jump in. You are our housing expert, but a lot of times people we serve cannot afford, it's hard to have enough to afford to be able to rent. And so they'll apply to get housing assistance to help subsidize their house. And so that's what Camille does. But Camille, if you are still on, I'm gonna give you a few minutes to answer.
Hi, I am still on. I apologize. I'm a busy woman today. I'm so sorry. Absolutely. You know, even if you're just somebody that provides services to individuals and not so much the housing aspect, it's still good resources. I think it's good. We're also going to have other providers come out and do training with us. So you're learning from peer to peer. We want to have support coordinators. We've got that lined up with providers as well. But I think it's just good to know that these resources are available to help the folks that you do service, because a lot of individuals cannot live successfully in their community and be part of that community without the supports and affordable housing combined together. So we want to make sure everyone is educated that both housing and services go hand in hand. I hope that answered your question.
So is your training only on housing? And if so, does DSPD have a training symposium? I remember years ago there used to be one, and maybe there still is, and I've just lost contact with it. I guess that's my question.
So what Camille does is specific to housing. And we have core training for support coordinators, but we don't have like a training symposium for providers. However, that is some of the feedback that we've been hearing more recently as people have been giving feedback, is to have some core information available that is consistent. And so that is something we are looking at developing further. We're looking at we did recently roll out the Medicaid 101 training. It's something that's going to be required in our provider system annually. I saw there was a question about like having HIPAA training. That isn't one that we have looked at, but it's definitely like we've got that on our list of things to look at right now as well, since you asked the question. Joel, if you have feedback on areas where you are interested or see like a need or a gap, we definitely would love to hear from you. You could send it to dspdinfo@utah.gov. But really, if you send it to anyone, we'll follow up. But that at least gives us a single place where it's being sent, so that we can make sure we're getting that and able to respond.
Okay, thank you.
Yeah.
Another question or two. I noticed in one of the audits why it asked about trauma-based training. Would that be like TBRI? Like what type of trauma-based training are they looking for there? And also years ago, why they mentioned MANT and SOAR specifically for type of behavioral training. Are there other places other than just MANT and SOARs? How do I find a list of acceptable trainings that are in that area as well?
So there should be a list of approved behavioral intervention trainings in our rule. And those to add one to that does go through the State Behavior Peer Review Committee. If someone is requesting to add one, that it gets evaluated for right, it gets evaluated to determine if it meets the needs of our system and is like the least intrusive, most adaptive kind of intervention. So there are a couple of others that are listed there. But I don't have them offhand, so we can get that answer to the question, and we'll get it posted following the meeting. It looks like Bruce put a link to the rule in the chat if you wanted to look there. And there's a comment that says HIPAA issues are in the support coordination contract as well. it's true, like our contracts definitely require everyone to be HIPAA compliant because we're, right, because we're all Medicaid providers, which means that we have healthcare information that has to follow HIPAA and be protected. I don't know if that was just a comment or if it was a request for training as well. If it is, we'll go ahead and add that to things that we're considering. Matt, I don't know if you have an answer to this question, Matt Lund. The question is, do we have a list of current DSPD service codes that require EVV?
We are working on that list. We're in the process of making pretty big changes to our website, and we'll publish that list right on our website, so it's easier for you to find. It currently is on our website. I think it's buried in a PowerPoint in one of the training links at the bottom of the page, but I think within a couple weeks it will be much more prominent. You can also send an email to our team and get that list.
Thanks, Matt. And it looks like Dean pulled out the approved behavioral interventions and put that in the chat. It's MANT, PART, CPI, SOAR, and safety care.
Thank you.
You're welcome.
Safety care looks like it would be very difficult to Google and find out where or what, even like that would just bring up a million different things. Like, is that a company name or what?
It's the name of the program. So I don't know if, like, you might
Like,
want
how
to
would
put
I find
some
that?
parameters around it when you're searching, as far as like behavioral intervention supports might help narrow the field. And the programs that are in there are because there have been providers that wanted to use them, and so they requested that review. So if you know of a provider that uses them, that might be a great place too. I don't know if you saw, but someone put a link in the chat for that as well. If you don't have any other questions, I did want to mention we have received some questions around the contract, feedback on either concerns people have or recommendations they have. I just want to make sure you know we're looking at and evaluating those, and we know that we have some more coming in, and we're just trying to do this in a comprehensive way instead of just kind of piecemealing things together. So once we know we've gotten feedback, we know some other questions or feedback is coming. Once we're able to get through all of those, we'll be sharing that information with you all as well. I just wanted to make sure you know we have received some. We're listening to what you're saying, and we'll be circling back with you. So thank you all for coming. Our next quarterly meeting is on December 12th. So have a great day, and I look forward to seeing you then if I don't see you before. Bye.